The human body is an absolute wonder of nature, capable of a great many interesting things that most of us take for granted. It possesses a state-of-the-art stereoscopic imaging system, your eyes, an olfactory system that can detect subtle variations in the composition of substances, your nose, and a complex system of organic hydraulics, which can be trained to lift and support several times its own weight, your bones and musculature, among other fantastic features. It also has a lot of bells and whistles of the type that are not exactly essential to survival, but are still pretty cool. Every time you whistle or snap your fingers, for example, you should probably take a moment to think about the first person to ever spontaneously do those things, then think to themselves, whoa. Some folks, though, are sort of like really expensive luxury cars in the sense that they come equipped with extra bells and whistles that are in no way necessary, but add a wow factor far beyond, say, flipping your eyelids inside out like that one weird kid in elementary school used to do. Most of these things have a genetic component, while some can maybe be learned, but all of them are pretty rare, so if you can do any of them, you can consider yourself special. Spread your toes and bend your feet. Most people's feet are, well, pretty boring. Sure, they allow us to walk and all, but they don't really do much else. Roughly 1 in 13 people, though, have an extra feature added to their feet, as described in a study titled Brief Communication, a Mid-Tarsal, Mid-Foot Break in the Human Foot by Jeremy M. Da Silva and Simone V. Gill, a pair of Boston University scientists. What is a mid-tarsal break, one might ask? Well, it means that the ligaments that support the joint between the heel and ball of your foot are softer and less rigid than normal. A gift from our ancient ancestors that allows some people to have more flexible feet than others. If you're able to spread your toes or if your feet are otherwise, well, bendy, then you are probably one of those lucky people. Obviously, for those ancestors, this would have been helpful for doing things like climbing trees. But as far as humans go, the jury is out on whether having bendy feet is beneficial. Da Silva, for instance, thinks that having this trait makes walking less efficient, but others, like UK researcher Robin Crompton, expressed a different view, opining that flexible feet could actually add stability in certain circumstances via New Scientist. Until this is settled, you bendy-foot people can simply enjoy your ability to climb trees better than the rest of us with your weird, grippy toes. Wiggle your ears. One could make the case that there is absolutely no benefit to being able to wiggle one's ears. One could make an equally strong case that this is malarkey because somebody making a funny face while wiggling their ears is objectively hilarious. In any event, this appears to be an ability that is purely vestigial, being left over from the common ancestor of humans and primates, both of which can still display this ability. The rub, according to a study titled Evidence for a Vestigial Pinna-Orienting System in Humans, it doesn't seem like the ability served any purpose in those ancestors either, with, of course, the possible exception of hilarity. Whether this ability is purely genetic or can be learned is somewhat unclear. While the study's authors seem to regard the ability as being purely genetic in nature, others are not so sure, like Dr. Kristen Woodward, an anesthesiologist who has independently researched quirky body phenomena and who is probably a huge hit at parties. Speaking with Glamour, Dr. Woodward said, "The ability to wiggle the ears may be inherited, however it can also be learned with practice. It is thought that about 10–20% of the population has the ability. So, if you can't wiggle your ears but want to learn, just spend a little while every day trying really hard. Even if you fail, you'll probably look just as hilarious as if you had succeeded." Bend your thumb backwards. The ability to bend your thumb way, way back is commonly referred to as hitchhiker's thumb, although frequently hitching rides will not make your thumb any more bendy. The trait has been the subject of multiple scientific studies. One, published in 2012 under the impressively scholarly title, The Prevalence and Comparison of Bent Little Finger and Hitchhiker's Thumb in South Nigeria, found that it may be present in about 1/3 of the population. This, however, may be a slight oversimplification, for it has also been suggested that thumbs fall into more categories than simply regular and extra bendy. In a series of papers titled Myths of Human Genetics by University of Delaware professor John H. McDonald, the notion that thumb type is binary was picked apart. The author pointed out glaring inconsistencies and the use of arbitrary criteria in previous studies, concluding that most individuals have intermediate values, not the two distinct kinds of thumbs described in the myth. one could be forgiven for reaching their own conclusion that Professor McDonald had a great deal of time on his hands and also 2 thumbs of decidedly medium bendiness. Dislocate your shoulder voluntarily. Here's where things get a little bit wince-inducing. Remember, in the 1987 action comedy classic Lethal Weapon, how Mel Gibson's character could pop his arm right out of its socket at will. And then he could pop it back in by dramatically and painfully slamming it up against the wall? Well, it turns out that some people can actually do that, and while it can certainly be painful, it's nowhere near as badass and dramatic. According to Raleigh Hand to Shoulder Center, these people suffer from a condition succinctly referred to as shoulder instability, and some of them, who are just as succinctly called loose-jointed, can easily pop their shoulders in and out of their sockets with little or no pain at all. It's unclear what percentage of the population are able to do this, and while the ability is often associated with trauma to the ligaments or muscles surrounding the shoulder socket, this is not always true. In 2012, a paper titled Voluntary Anterior Dislocation of the Shoulder in a 10-year-old Child Treated Surgically described such a case. The patient was able to pop the old right arm in and out of the front of the socket at will with no pain, despite there being no history of injury to the area. The condition was rectified by way of surgery, so if you're able to do this, you can treat it that way, or you can just keep doing your party trick and freaking out your friends. Touch your tongue to your nose. You have probably at some point encountered some wiseacre who says,
"Hey, I can stick out my tongue and touch my nose."
They then proceed to stick out their tongue while touching their finger to the tip of their nose, then guffaw like they just totally pulled one over on you. You complete buffoon. Everyone knows that virtually nobody not named Gene Simmons can stick out their tongue that far, except that this is not the case. In fact, roughly 10% of the general population can perform the maneuver known as Gorlin's sign, much more than one might think. And if you happen to be afflicted with the condition known as Ehlers-Danlos syndrome, a non-general segment of the population, chances are that it's easy. According to the National Library of Medicine, EDS is a genetic condition that affects the body's production of collagen, as well as the properties of that vital protein. The bodies of those suffering from it can exhibit a number of unusual properties, but it is characterized by a general, rubberiness of the joints, organs, and skin, and severe cases can cause serious problems ranging from fatigue and chronic pain to the wanton rupturing of arteries and organs. The ability to touch your tongue to your nose is sometimes indicative of the presence of this disorder, but usually it just means that you're the lucky 1 in 10 who can win bar bets for the rest of your life. Sneeze with your eyes open. Sneezing is one of those bodily functions that most people have a love/hate relationship with. Sure, a good sneeze can feel satisfying, except when it's immediately followed by another one and another and another. Also, it sometimes seems like they come along at some pretty inopportune moments, while you're changing lanes in traffic, for example, or when you're about to field a fly ball. This is annoying because, as you might have noticed, it's virtually impossible to sneeze without closing your eyes, and yet it can be done. Nobody is exactly sure what the evolutionary purpose is behind your eyelids automatically slamming shut when you sneeze, but according to allergist Dr. Purvi Parekh, sneezing and the accompanying eye closure is what's known as an autonomic reflex. Other things that fall into this category include swallowing and breathing. In other words, these are bodily functions which are very difficult to override. Speaking with Well and Good, Dr. Parekh explained that with practice, one can learn to keep their eyes open while sneezing. It's just really tough to do. If you're prone to allergy attacks and find yourself in heavy traffic often, though, it may not be a bad idea to give it a shot. Contort your tongue into weird shapes. The ability to fold your tongue lengthwise, while not universal, is a fairly common trait. As described by Dr. John H. McDonald in his Myths of Human Genetics series, this ability has in years past been used in classes as sort of a basic introduction to genetics, but, says Dr. McDonald, this is a fallacy. While the trait may have a genetic component, the prevalence of rolling children born to non-rolling parents, and vice versa, suggests that it's a bit more complicated than whether or not one has a tongue-rolling gene. Also, upwards of 2/3 of the population can do it, and it has been demonstrated that it's relatively easy to learn. There are, however, weird tongue maneuvers that are quite a bit less common, according to a 2020 study titled 5 Specific Tongue Movements in a Healthy Population conducted in the Netherlands. It was found that while 83% of the study's participants could fold their tongue lengthwise, far fewer could fold it widthwise, about 27%, twist it to the left or right, around 35%, or make that cloverleaf shape with it like your really weird buddy Dave, roughly 15%. When it came to the physiological reasons behind these abilities, though, the study drew a big old blank. Raise one eyebrow. Cocking one eyebrow is a great choice for when you want to look quizzical, express possibly ironic interest in something, express incredulity, or look like Mr. Spock. Some can do it effortlessly, and some don't seem to be able to do it at all. And this is another skill for which the genetic component, if any, is not known. There is one study, however, that suggests a correlation between the ability to raise one eyebrow independently of the other and another, completely different useless skill. The 1995 study titled Asymmetries in Ear Movements and Eyebrow Raising in Men and Women and Right and Left-Handers examined the relationships between the abilities to raise one eyebrow and wiggle one or more ears, looking for any increased instances of either among right-handers, left-handers, and ambidextrous people. It found none, but it did conclude that there were significant contingency correlations between single brow raising and ear wiggling. It stands to reason that this may have something to do with certain qualities of the facial muscles in people that can cock a brow, wiggle an ear, or both. But if that's true, nobody has been able to ascertain what those qualities are yet. Don't count science out on this one. Thanks for watching. To stay updated on the latest discoveries, make sure to subscribe to my channel and turn on notifications.